For our presentation, we did post-traumatic stress disorder. PTSD stands for post-traumatic stress disorder. It's a disorder in which a person has a difficult time recovering after they experience or witness a terrifying event. PTSD is now included in the trauma stressor-related disorders category within the DSM-5. The DSM-5 is a medical handbook that provides health professionals with criteria and definitions to classify diseases. For all conditions included in the classification of trauma and stressor-related disorders, exposure to a traumatic or stressful event is demanded as a diagnostic requirement. It can develop following a protracted traumatic encounter or following a very tense, frightening, or upsetting incident. Serious accidents are one-of-a-kind occurrence that might trigger PTSD symptoms. Can include the following as assault, either sexual or physical. PTSD develops in about 1 in 3 people who experience severe trauma. Events that can trigger PTSD are major mishaps, abuse, physical or sexual maltreatment in infancy or marriage, exposure to stressful situations at work, even when working remotely, major health issues such as being hospitalized to a critical care unit, situations related to childbirth such as losing a kid, losing a loved one, or being in a war or being tortured.
The changes on the brain of PTSD. PTSD alters the brain to always be on danger mode. This meaning that you are always on high alert even if you are not in the situation or place anymore. PTSD does not allow the feelings of fear or sadness to fade away after a traumatic event. Flashbacks are common in trouble sleeping also. Another way PTSD can affect the brain is issues within relationships with friends and family. It is harder to trust or go places that remind you of the traumatic event. The part of the brain that associates with fear and emotion is affected tremendously more with people that are diagnosed with PTSD. The changes on language and cognitive development. The changes on language and cognitive development vary with people diagnosed with PTSD. Cognitive impairment is one thing that PTSD can lead to, which is when people have a hard time remembering, learning, being able to concentrate, and making decisions. Some people may also have a hard time with being able to regulate their emotions. Impulsive behavior is common in getting overwhelmed very easily. Regulating emotions can be affected at a traumatic event in young age or early childhood experiences. Moral and personality development. Moral and personality development can be affected by guilt and shame, which are common symptoms of PTSD. The fear of betrayal and trust issues are also common side effects when something traumatic occurs. Personalities can be affected by PTSD because of disturbing, intense thoughts and feelings. A lot of people diagnosed with PTSD have low self-esteem, which could have developed just from a traumatic event. Moral development can also be affected by not being able to regulate the body's stress and can increase indecisiveness. It is harder to understand and develop emotions when your fight or flight response is compromised. Populations being affected. In women, about 8% are likely to get PTSD in their lifetime, and men are 4% likely to get it. Women are more prone and twice as likely to develop PTSD in their lifetime than men are. The most common group that is affected by PTSD is women that have experienced sexual violence. From studies, 1 in 4 women will be a victim of sexual violence. The age group that develops PTSD the most is young and middle adulthood, so ranging from the ages of 15 to 39. The treatments that are recommended: cognitive behavioral therapy, cognitive processing therapy, cognitive therapy, prolonged exposure, brief eclectic psychotherapy, eye movement desensitization and reprocessing therapy, narrative exposure therapy, and medications. Enhancing week-long psychological treatment for PTSD with ketamine. Study type is interventional. Eligibility 21 years to 70 years. does not accept healthy volunteers. Locations: Yale University School of Medicine, New Haven, Connecticut, United States. This study aims to determine which combination of intense trauma-focused psychotherapy and ketamine will be more successful in treating post-traumatic stress disorder. It is possible that this week-long treatment will result in a major therapeutic benefit that might otherwise take months to manifest. Learning about the neuropsychological alterations brought about by the suggested clinical trial will also be a major goal of the research.